Now, I'm not married, so it's easy for me to say that. My wife, or future wife, or if if there's a future Mrs. Ryan out there somewhere, may not agree with, being in the public option. But I think it is going to be a good system. I think it's going to work. I will go into the system. But what we're, in essence, trying to do is trying to give every American the same kind of health care that we have, where we have, I don't know how many different plans, 7 or 8 different plans that we go into and pick what we want and then pay, for better coverage or less coverage. We're trying to give that same choice to the American people. And if you make, under the current plan, if you make under $80,000 a year and you're a family of 4, you're going to get some help. You're going to get some subsidy. And the closer, the closer you get to Medicaid, which we expand to 133% of poverty, the more of a subsidy you'll get. And so we want people to be able to afford it. And again, they will have copay. They will have skin in the game. They will have to pay their premiums. But right now, we're not getting anything out of those people. And I think when you talk about where we're getting some of this money, the people that are going to the emergency rooms will now be paying and will now have skin in the game.
Thank you, sir. The American public is confused as to what is going on. On the one hand, it's said that we have to cover these people who are not covered by insurance. We know that's going to cost a lot of money. On the other hand, you say we have to save money so we can sustain it economically. How do you resolve this very real conflict?
We're paying for them now. Those people are costing us a hell of a lot of money. They go to the hospital in the emergency room. They're way sicker than they need to be. The doctor doesn't get paid, the hospital doesn't get paid. So when you go in with your insurance card and your coverage, their procedure is reflected in your cost of your own health insurance. It's being pushed from them and the hospitals and docs onto people who now have health insurance. And so where we're going to save money is by investing in the front end and giving those people prevention. That's how you're going to save a lot of money. And we're going to ask people who make more than $1 million. I mean, who knows where it ends up, but we're asking people who make more than $1 million a year to pay a surcharge in order to help us do this. And they have done pretty well over the course of the last decade, and I think it's fair enough to ask them to help us. But again, they're already paying for these people.
But this current proposal isn't deficit neutral.
Why not?
Well, according to the Congressional Budget Office.
Well, and again, in their analysis, they have not this is the Congressional Budget Office, which is totally nonpartisan and have kicked our butts as Democrats with our proposal, and the same with Republicans on different proposals that they have. But in their analysis of our health care bill, they did not factor in prevention. Now, how can you have an honest analysis of what we're trying to do and not factor in prevention? Yeah, we got 50 more million people coming in to the healthcare system, and we're not going to account for the fact that they're going to have preventative care. We're not going to account for the fact that we're going to have incentives for wellness and pushing the system towards a more wellness-based system.
So is there $200 billion or $230 billion worth of savings in preventive care and wellness and all of that?
Well, there's about $500 to $600 billion over the next decade in savings. Think about how much Medicare will save if everyone from 55 to Medicare age has health insurance. Instead of waiting to dump all of your care and your costs onto the Medicare program, you're going to get these screenings, and you're going to catch cancer early. All of these things are going to save Medicare a boatload of money too. So all of this comes together, I think, in a very comprehensive way. And the same, this isn't, and we have this conversation. We're talking about healthcare. We need to talk about the kind of food we eat and the kind of stuff that we're feeding our kids. We need to talk about pop in schools. I mean, this needs to be a health and wellness education among our young kids, the lack of exercise among our young people. I mean, all of this needs to be part of the national discussion.
You going to take on the Farm Bill next?
We already did that, so we need 5 years in between that. But we made great strides in that with the food stamp program and a lot of other investments into healthier food, new reforms at the FDA. These are all part of, I think, what needs to be a comprehensive plan on this.
Let's take another question.
Gentlemen, I thank you very much for coming here today. I'm no constitutional scholar, certainly not as learned as you two. as you know, the Congress is limited in the activities it can undertake by the Constitution. Some 18 duties that the Constitution gives Congress to do, and no more. Which of those duties would be covered by the institution of your public or government option?
I don't know that we have a constitutional expert to answer that. We'll maybe defer to the Supreme Court. But I will say this, sort of broadly, is that government has the opportunity here to set the goalposts, to set the out-of-bounds markers, and let the free market work in between. And whether you're talking about the Commerce Clause in the Constitution, or you're talking about the duties prescribed by Congress to set those goalposts for the opportunity for the free market to engage freely and cover everybody, I think that is more the position that we would want to take. I don't think that Tim Ryan or any other member of Congress who are sitting here or who will discuss this issue want to go into each individual plan and set the rates. It's going to cost $50 for a hospital visit or $100 for an immunization. We don't want to do that. We want to let the free market do it, but we want to make sure that these guideposts and principles are covered. And maybe the idea that we have on the table in the House of Representatives needs a little bit more work. Maybe there are others who argue that we haven't gone far enough. But broadly, I think we need to set the out-of-bounds markers, set the goalposts, and act as a good referee and throw the flag when folks move out of that position.
Can we get another? Oh, no more questions. I think we're done with the questions for now. We are done with questions? Apparently we're done with the questions. Thank you very much. Please, a round of applause. Thank you for the round of applause for Congressman Tim Ryan and Congressman John Boccieri.
Today at the City Club of Cleveland Forum, we have been listening to Congressman John Boccieri of Ohio's 16th District and Congressman Tim Ryan of the 17th District, and moderated by Dan Moulthrop of WCPN Idea Stream. Thank you, Congressman. Thank you, Mr. Moulthrop. Thank you, ladies and gentlemen. This forum is now adjourned.
For information on upcoming speakers or for podcasts of the City Club, go to cityclub.org.